We reported here at News 10 that experts are saying this is the most severe flu season in the past 15 years. Speaking on the intensity and how to protect yourself is Dr. Matthew Gasteiger, a primary care physician at McLaren Greater Lansing. Dr. Gasteiger, what sicknesses and viruses are contributing to the severe flu season this year, and how are you seeing that reflected with the patients coming in to see you?
We've been seeing a lot of just people coming in for general upper respiratory type illnesses, which we don't necessarily find out exactly what's causing it. But we've certainly been seeing a lot of flu positive patients in our practice. We've seen some RSV as well, and certainly some COVID too. And I've definitely seen patients admitted to the hospital for some of these infections as well.
It's a variety of illnesses that you're seeing right now. You just named about 4 to 5, so that is a lot going on across our area and even across the country. You mentioned you don't know specifically what's causing all of this, but what are some of the possibilities that contribute to it?
It's hard to say why this year we're seeing so much more flu than prior years. It seems to have kind of supplanted COVID, and now we're seeing much higher flu rates than prior and lower COVID rates. So it's possible that there's just a little bit of a trade-off there. The COVID is not as prevalent, so flu is kind of taking over instead.
That's good to know. We're seeing a lot more new viruses. COVID's been around for about 5 years now, but we're seeing more and more of these pop up, and we're seeing more cases being reported. Now, we don't want to see those cases being reported, but it's great people are speaking up about it. How can they protect themselves, limit the spread, and also protect others?
So all the generic things that you think about when you're sick: washing your hands, covering your mouth when you cough or sneeze, trying to avoid touching your face, staying home if you can when you're sick. If you can't afford to stay home, considering wearing a mask if you're outside while you're actively sick. And then probably most important is getting the flu shot at your pharmacy or at your local doctor's office.
Sounds good. So also taking proactive steps to make sure that you're limiting getting yourself and others sick as well. Now, sometimes we do take those precautions, we take those steps, and hey, you're still getting sick. We're always touching surfaces, we're in different environments. When is the time to go to a doctor or even to the ER if you're noticing your symptoms acting up more?
So people who have a lot of chronic medical conditions or who are older are definitely the people that are at higher risk. So if you have more chronic conditions like respiratory diseases, COPD, diabetes, if you're older, over the age of 50 or 65, if you're pregnant, those are all people who are higher risk. So I would have a lower symptom threshold to go to the emergency room, or to go to your doctor. And certainly if you're developing shortness of breath beyond just kind of a standard cough, if you're developing chest pains, or if some of your chronic illnesses are getting worse while you're also sick, those would definitely be reasons to call your doctor's office or go to the ER.
Those are definitely reasons to go to the doctor or ER, and I appreciate you for mentioning the other symptoms that people who might not be at higher risk could also experience. Dr. Gasteiger, thank you so much for joining us on Mid-Michigan Matters.
Thank you for having me.
Time now to take a look at what we're working on for News 10.